Delayed healing and wound complications can be a significant care and cost burden. Wounds at risk of bacterial colonization and infection can result in excess length of stay and hospital charges. 3M Veraflo Therapy combines automated topical wound solution installation, distribution, and dwell to cleanse wounds with the benefits of negative pressure wound therapy to help facilitate the removal of wound exudate and other infectious material. But there are several other reasons to start the wound healing journey with Veraflo Therapy. Let's first see how it works, then examine the data for why you should consider Veraflo Therapy as a potential first choice to help promote wound healing. When it comes to removal of infectious materials, Veraflo Therapy is a smart way to start. In the first stage of the repeated cleansing cycles, Veraflo delivers topical wound solutions that dwell in the wound to help dilute and solubilize infectious material. Then, solubilized wound debris and infectious materials are removed under negative pressure to remove bioburden. Next, the negative pressure phase of Veraflo Therapy promotes granulation tissue formation and perfusion to prepare the wound for closure. Now that you know the mechanism of action, let's look at the data behind Veraflo Therapy. In a porcine full-thickness excisional wound model, the average granulation tissue thickness after 7 days treatment of Veraflo Therapy with saline was 43% greater compared to 3M VAC therapy. Based on a published systematic literature review and meta-analysis, Veraflo Therapy was found to offer statistically significant advantages when compared to control, which included VAC therapy. Approximately 1 less debridement was required for Veraflo Therapy. Wounds were ready for closure almost twice as fast. Wounds were 2.39 times more likely to close. Length of therapy was reduced by more than half. Odds were 4.4 times greater for reduced bacterial count from baseline. As the data has shown, Veraflo Therapy is a smart way to jumpstart your patient's wound healing trajectory. Let's look at how Veraflo Therapy has helped patients. A 26-year-old female was airlifted after a boating injury in a brackish water lake that resulted in significant avulsion injuries and a Gustillo 3B fracture. Upon arrival, the patient was taken to the operating room for a transfemoral amputation due to the extent of the injury. The amputation resulted in a soft tissue defect that was debrided of devitalized tissue and irrigated. VAC therapy was applied at -125 mm of mercury. By day 9, the patient was in critical condition following another debridement and irrigation, and debridement was no longer an option. Veraflo Therapy with 3M VAC Veraflo Cleanse Choice dressing was initiated to cleanse the wound. After 4 days of Veraflo Therapy, wound healing progressed. By day 17, there was a substantial decrease in devitalized tissue, an increase in vascularity, and a significant increase in granulation tissue. Veraflo Therapy was transitioned to 3M VAC Veraflo dressing. On day 43, the patient underwent a tangential excision and split-thickness skin graft, covered with a non-adherent layer and bolstered using VAC therapy. After successful wound closure and physical therapy, the patient was able to take her first steps with a new prosthesis. When choosing Veraflo Therapy, there are also economic benefits to consider. Based upon the Gabriel meta-analysis data shown earlier, an economic analysis compared the potential cost savings associated with use of Veraflo Therapy versus control in 3 different countries. The study shows use of Veraflo Therapy has the potential to result in up to 50% cost savings compared to control. Now that you've seen the data and the results, consider making Veraflo Therapy your new standard of care.